Today we're going to be talking about what to do if you've had a degenerative meniscus injury, or in simple terms, that just means if the meniscus injury occurred without a specific mechanism of injury, or you don't actually know why that meniscus injury popped up in the first place. Especially if it's, again, not a cause of a specific mechanism of injury. It's been shown through research that really surgery is no better than just general strength training, general rehab done in a progressive manner. And so one of the simplest things you can do is just hop on a bike and do so on a frequent basis, because it takes your knees through a large range of motion, much greater than what you'd experience walking, running, or on the elliptical. Biking requires about 120 degrees of knee bend, and it's going to take your knee through that range of motion on a frequent and often basis. So this is the number one thing that I would start doing on a day-to-day basis. Think about this almost as a weekly vitamin for you. We're going to cover 5 weekly vitamins that you need to be doing from a movement standpoint if you've had a degenerative meniscus injury with no specific mechanism of injury. So biking is what I would start first and foremost. Again, we're going to cover 5 different things that you should be doing on a weekly basis, but I wouldn't just do them once a week. I would try to get them in 3 to 4 times a week, especially if you're currently experiencing symptoms. If you're not experiencing symptoms and you just know you've had a past history of meniscus issues, probably get these in just once a week at that point in time. Biking you can probably do every single day, done the most frequent. That's the least intense as far as the exercise goes on the stress to the meniscus. Just more about the repetitive motion there. Second up in the vitamin dose for the meniscus would be to do some form of a wall sit. Again, 3 to 4 times a week if you're dealing with it in pain. Once a week if you're just looking from a maintenance standpoint and you're no longer in pain. Just holding that bottom position is the least aggressive form of the exercise. So you can just hold that position somewhere around 30 seconds to a minute, 3 sets. Now, if that feels super easy for you, we can make it a little bit more dynamic by putting a foam roller that helps you slide up and down the wall. Again, you can do this on 2 feet, going through a larger range of motion. But where this is really useful is keep an eye on the shin angle here. The shins are vertical. That means there's going to be less stress placed on the meniscus. Oftentimes you'll find that much more comfortable for people dealing with meniscus issues is having a vertical shin with the exercise. So we can do this on 2 legs to start making it more dynamic, which is a little bit easier again than a squat where there's more of that forward knee shin translation that's happening during a squat. So this is why I prefer you can use a stability ball, foam roller, that assisted squat sliding up and down the wall on 2 legs. You can make it even harder by going to single legs, so depending on where your capabilities are, you can always advance this exercise as well. The third weekly dose of vitamins for a meniscus injury is some sort of hamstring exercise. This is going to stimulate the posterior aspect of the knee, or behind the knee. You're going to feel a lot of tension here. This is easiest form is a 2-legged bridge, and then we can make that harder by again making it dynamic, pulsing up and down. And if you're holding, same thing as the wall sits, 30 seconds to a minute. If we're pulsing up and down, we're shooting for 6 to 10 reps. 2 legs being easy, we start switching that over to 1 leg. And again, if you find both of those variations to be really hard and stressful on the backside of your knee, then we need to just scoot in closer to the bench. So we shorten the lever arm and make the exercise easier in that way. But eventually we do want to scoot out away from the bench and have a very minimal, about 10 degrees of knee bend occurring during this exercise. Last up is a graded exposure progression back into allowing the knee and shin to translate forward. As we mentioned in the wall sit, keeping the shin vertical is oftentimes most comfortable for people with degenerative meniscus issues. Not always, so there can be some differences in people, but in general that tends to be the case. So this is the last exercise, the final one in our weekly vitamin dose, is doing a split squat, allowing that knee to translate forward over top of your shoelaces. So the easiest form is to elevate your foot up on a high box or a stairwell, and by elevating the foot, you're taking away a lot of the resistance that gravity would give you if you were to do this flat on the ground. So elevating the foot up somewhere around 20 inches, 24 inches, 16 inches, that generally is around the right height for most people, is between 16 to 24 inches. Find what feels natural and comfortable for you to allow that knee to start moving forward over top your shoelaces. If it doesn't feel comfortable, you're just simply not ready for it yet. So hold off, wait a little bit longer. But most people can get started with this high box split squat. And then what we're going to do is we're going to advance the exercise, again, graded exposure, progressive manner in a systematic way. We can hook a band up to the pull-up rack to give us assistance as we lower down to the floor. Again, we're still using a small box at the bottom, so about 4 inches. This, again, takes away some of the demand of the exercise from a gravity standpoint, and you'll find it feels more natural just doing it on about a 4-inch box. And as that assistance gets easier and easier for you, we can lower the assistance by using less and less of a band. Eventually, we want to be doing it just straight body weight. From a backside, here's what it looks like. Your back foot is light on the ground, that heel is up off the ground, and your feet are super narrow as you're lunging and weight shifting forward onto that front leg and then pushing up and back away from the front leg. So if we look at that program in totality, what we have is biking done frequently, every single day if you can, especially if you're having symptoms. The rest of the program is done 3 to 4 times a week if you're having symptoms. If you're not having symptoms and you just know you're dealing with meniscus injuries of the past, then just once a week will suffice for this. That should give you a good start of helping you recover from a meniscus injury. Again, I don't know your circumstances, so this is not specific advice to you. If you'd like specific advice and you'd like to work together one-on-one, then you can reach out to me for an online consultation. We'll work at developing a specific program for you, head to toe. It doesn't have to be just related to a knee. It can be a full body workout routine. Email me, greg@sportsrehabexpert.com, and there's also a link down in the comment section where you can sign up to my booking calendar and book an online session with me directly.